Thank you, Mr. Chair and members. SB 1139 will remove barriers for undocumented students pursuing medical profession careers by ensuring that all students, regardless of their immigration status, have access to the state scholarships and loan forgiveness programs for health professionals who work in medically underserved areas. In addition, the measure will codify the eligibility of undocumented individuals who meet the requirements to apply for medical schools and medical residency training programs. The Health Professions Education Foundation is statutorily created not-for-profit foundation that awards scholarships and loan repayments targeting health professionals who provide culturally and linguistically appropriate care within medically underserved areas. Undocumented individuals who work in underserved communities at a higher rates than their peers and can help the state address the chronic shortage of medical professions within underserved communities. Recipients of the foundation scholarship or loan repayment programs can receive grants between $4,000 to $105,000. Most undocumented students, include those in medical fields, face major challenges financing their education. Many struggle to access private loans and do not qualify for federal loans or loan forgiveness programs. Currently, the foundation program application does not allow the use of the individual taxpayer identification number known as ITIN as a substitution for a social security number. Despite that fact, medical licensing boards already accept ITIN, the ITIN number. Undocumented students also face challenges when applying to medical schools and medical residency training programs, as their immigration status may hold precedent over their academic qualifications, prompting admissions personnel to question their eligibility. These present a barrier for undocumented students can currently get a license to practice but do not have the access to financial resources as their documented peers. SB 1139 removes this barrier by enabling an applicant to provide an I-10 in lieu of a social security number, and by also codifying the eligibility of undocumented students for medical schools and medical residency training programs. SB 1139 will further facilitate pathways to medical professions for undocumented students. Ultimately, this bill will level the playing field for all students and help the state increase providers in medically underserved areas. Members, just as a reminder, we have already invested in these students, and we as a legislature have recognized that these students are contributing to our economy and are part of our society and deserve every opportunity to succeed, just like any other California student. This is, once again, taking another bite at the apple and ensuring that every student in this great state of ours, the most powerful state in the country, have access to pursue their American dream. I respectfully ask for your aye vote.
Thank you. Those in support, state your name and position.
Kimberly Chen with the California Pan-Ethnic Health Network, proud to co-sponsor SB 1139, and want to thank Senator Lara for his leadership on this issue and carrying this important measure. With the implementation of the ACA, more Californians are newly insured now, but many are still experiencing a shortage of primary care providers. In fact, nearly 17% of Californians live in a federally designated medically underserved area, and many of these folks speak another language and are from communities of color. And given the need for culturally and linguistically appropriate care in these underserved areas, undocumented individuals can serve as key practitioners to address this chronic shortage. This bill takes an important step in addressing this issue, ensuring that all individuals, regardless of immigration status, can compete in these medical training programs and state-funded scholarship and loan forgiveness programs. And for these reasons, CPEN is in strong support and urges your aye vote.
Good afternoon. My name is Regent Corpus, the policy advocate for Pre-Health Dreamers. We are a growing community of 650 undocumented youth who are pursuing health professions in over 40 states, largely in California. And we are here today because we are an organization that wishes to ensure and remove as many barriers as possible for many undocumented youth who wish to enter into health professions and to succeed, whether this is through policy or institutional support. And going forward with this, as my colleagues have said, in SB 1139 is a key bill. It is to extend an existing opportunity to those who have committed to a career in addressing the current health disparities, especially here in California, but is going on throughout all the nation. With me are two wonderful speakers who share a lot of the sentiments and aspirations of our membership, Marcela Jo Wang and Eric Leyva. They are representing many of a majority who are either already in the health profession, whether in medical school, dental school, or those who are prospective students, prospective applicants. They are from the communities we wish to address health equity. And by investing this existing opportunity, they can do a better job of addressing those health needs. And I'll turn it over to them.
Good afternoon, Chair and Committee. My name is Marcella Zhou, and I'm currently a first-year medical student in the Prime program in the David Geffen School of Medicine at UCLA. I was granted in DACA in December 2012, and the Prime program allows me to become a physician for underserved communities. In the 1980s, my parents left their villages in China to follow a wave of immigrants to Mexico to seek better job opportunities. They settled in Mexicali, where my sister and I were born. Through my formative years, I was immersed in the Mexican culture outside our house, and inside our house, we maintain our Chinese ancestry. Seeking better educational opportunities, my sister and I left our home when I was 12, and we moved to Calexico, California. At the age of 15, I was physically separated from my family, and I became aware of my undocumented status. I struggled with this identity. Instead, I chose to focus on thriving academically. In 2009, I graduated as the valedictorian of my high school class and went on to obtain a bachelor's degree from the University of California, San Diego in 2012. As I mentioned earlier, I'm currently a first-year medical student. Every day, I learn more about the severe health and socioeconomic disparities that we face in California. This, and along with everything I've experienced myself, and all these injustices remind me that I owe it to my community to become the best doctor that I can be, and also be an advocate and agent of change. I want to return to serve the communities that I come from, the Imperial Valley, the undocumented community, the immigrant community, the underserved communities. Being a medical student is no easy feat, but it can be much more challenging when you're constantly worrying about your funding or whether you can move on to the next step of your education. SB 1139 will empower aspiring physicians and other healthcare providers to have unmatched commitment to serve the underserved in our state. Because of these reasons, I support this bill and respectfully urge your aye vote.
Good afternoon, Chair and members. My name is Eric Leyva. I am from Santa Ana, California. I am here to express my support for SB 1139. After the passing of my father, when I was 2 years old in Mexico, my mother and I decided to immigrate to the U.S. Since my mother did not have the support from her family. I, along with my mother, immigrated to the U.S. when I was 5, but unfortunately, due to financial reasons, we had to leave my 2 sisters behind. In order to reunite a small family, my mother had to work 2 and sometimes 3 jobs in order to raise money to reunite our family. This took a toll on her body and overall health. As undocumented immigrants, we lack healthcare access. I realize our experience is a shared experience that not just my family has gone through, but in the overall undocumented community throughout California and the US. This has empowered me to pursue a career in medicine. As a senior at UCLA, I will be graduating this June. I have been accepted into 2 post-baccalaureate programs at Loyola Marymount University and Charles Drew University. Here I will complete my requirements for medical school, where I will hope to apply to a medical school here in California afterwards. SB 1139 will help individuals like myself and from similar backgrounds access to loan repayment programs that are already in place and would expand the eligibility for health professions like medicine. And this will help the physician shortage here in California and the rest of the U.S. I ask for your support of SB 1139. Thank you.
Thank you. I'd like to ask those in support, state your name and position only, please. Thank you.
Michelle Cabrera with SEIU California on behalf of our Committee of Interns and Residents, as well as the rest of our 700,000 members in support.
Thank you.
Beth Capel, Health Access in support.
Ronald Coleman on behalf of the California Immigrant Policy Center and the California Immigrant Health Network, also in support.
Andrew Medina of Asian Americans Advancing Justice California in support.
Jose on behalf of the California chapter of Doctors for America in support.
Lydia Buen representing American Academy of Pediatrics, California Division. We are in support. Laura Parr on behalf of the California Academy of Family Physicians in support.
Jessica Bloom, I'm an internal medicine doctor at San Francisco General Hospital in support.
I'm Daniel Yang. I'm an internal medicine doctor at UCSF in support.
Malia Pike Nicely, resident physician at University of California, San Francisco in strong support.
Dr. Jesse Humphreys, another resident as well at UCSF.
Anthony Galassi with the Green Lining Institute in strong support.
Mark Ard, fourth-year medical student with Loma Linda University in strong support.
Zach Wetstein, fourth-year medical student at UC San Francisco, on behalf of the medical student body of UC San Francisco, our dreamers and future California physicians in support.
Timothy Barbosa, first-year medical student at Loma Linda University in strong support.
Sarah Mae Smith, third-year MD PhD student at UC Irvine, here in support of the bill and our undocumented colleagues.
Rasha Ahmed, third-year medical student from Western University in strong support.
Will Mintier, first-year medical student at UC Irvine in strong support.
Oksana Rodriguez Torres, first-year medical student at UCI with the program in medical education for the Latino community. There is a huge likelihood that our dreamers will come back to their communities and serve their underserved communities, so strong support for them. Power to them.
Thank you, Mr. Chair. Eduardo Martinez with the California Medical Association. Also want to thank the committee's indulgence for allowing our medical students to participate here. Our medical students were the one that passed a resolution in our House of Delegates meeting to move us to a position of supporting programs and bills like Senator Lara. So thank you very much.
Harry Sanders with the Having Our Say Coalition, also in support.
Linda Way with Western Center on Law and Poverty in support.
Good afternoon, Mr. Chair and members. I'm Santosh Siram Santana, representing the California Asian and Pacific Islander Budget Partnership in strong support.
Lin Jung, Southeast Asia Resource Action Center in strong support.
Dr. Sharad Jain, Director of a Primary Care Residency Program at San Francisco General Hospital in strong support.
Lupe Aguirre on behalf of the National Immigration Law Center in strong support.
Margaret Lynch, internal medicine resident at UCSF in support.
Trevani DeFries, resident physician at San Francisco General Hospital in support.
Christy Sorn, internal medicine resident at UCSF San Francisco General Hospital in strong support.
Adia Scrub, fourth-year medical student at Charles Drew University, UCLA Prime in strong support.
Varsha Puri, general pediatrician at Children's Hospital, Los Angeles in strong support.
Gregory Kramer on behalf of Planned Parenthood Affiliates of California in support.
Maya Ingram, ACLU of California in support.
Dr. Braden Mugler, internal medicine physician at San Francisco General Hospital and UCSF and proud alumni of UCLA and Charles Drew University in support.
Elaine Kong, internal medicine resident at San Francisco General Hospital in strong support.
Colin Robinson, internist and pediatrician representing the AAP in strong support.
Dr. Linnea Shetner, internal medicine and pediatrics with the AAP in support.
Susan Wu, I'm a pediatrician in Los Angeles, a member of the American Academy of Pediatrics in strong support.
Mr. Chair, member Stephanie Roberson on behalf of the California Nurses Association in strong support of this bill.
Mr. Chair and members, my name is Angela Gaillard, and I represent the University of California Health System, the 17 health professional schools, and the 5 academic medical centers. We do not have a position on this bill at this time. We have talked with Senator Lara's office. Our medical school deans are reviewing the most recent amendments to this bill. We would like to be part of the solution, and we look forward to working with Senator Lara's office.
Thank you. We have opposition. If we can bring opposition up.
So why don't we have her? Yeah, just.
There's a total of 6 minutes allotted for support, testimony, as well as opposition. So, decide what order you guys would like to go and who would like to speak. Okay. And there's going to be 3 of you only, or is there others that are interested in speaking within the 6-minute time? Anyone else? Okay. I want to make it fair to both sides. I don't want to hear somebody say that this is not, so I'm just very, very clear. Anybody would like to speak for a period of time up to 6 minutes, we can come up here. All right, let's please proceed, state your name and your position. Thank you.
Yes, my name is Raul Rodriguez Jr., and I'm with America First Latinos, and we promote, I'm putting America first and Americans first. I'd like to testify that this bill is promoting illegal immigration. It is unconstitutional. Senator Lara continues to promote illegal immigration, passing bill after bill, which puts a burden on taxpayers in California. We do not and should not promote or allow this to happen. You individuals up there are responsible for doing the right thing. I want you to reach out to your conscience. To your conscience. Remember, this is not good for the American people. It's not good for Californians because this is coming out of our pockets. Nobody else. I have two granddaughters who are in the medical field. One is 25 and one is 21. They have to pay for their medical bills. And they aren't being allowed the same opportunity that these individuals are. They're getting rewarded for being in this country illegally, and I think it's wrong. That's why I'm asking you to challenge. I think the gentleman over there is asleep. Yeah. Is that correct? Anyway, that's terrible. That is terrible.
I would appreciate.
Anyway,
not.
Well, you should have paid attention. Anyway.
Hold on. Let's stop the clock right now. I am paying attention, sir. I'm giving you the full authority to speak for the full 6 minutes. But
I don't want to speak for 6 minutes.
Well, I'm within the
2 minutes.
So don't say that I'm not paying attention. Please proceed.
All right. Anyway, I'm appealing to your conscience to do the right thing. Please, do the right thing for the American people and not the illegals. Thank you.
Is this on?
It's on, and I'm paying attention.
Thank you so much. My name is Patrice Lines. I'm a retired nurse. I'd like to say good afternoon to Mr. Chairman and the committee. Thank you. First of all, SB 1139 is not in the best interests of California or the California U.S. citizen. Student, our children are dreamers too. They want to further their education. We want to encourage them to do that. And then when they go through the hardships, when they go through their long education to achieve a medical degree, which, you know, is a difficult process. It's quite expensive. It's $200,000 minimum for 4 years. They would like to work in the underserved communities and achieve these scholarships and loan repayment plans as well. And what you're doing on SB 1139 is you're increasing the pool of applicants to include illegal aliens, which could be coming from 195 countries worldwide. And therefore, it's inherently unfair to our U.S., California citizen students who are also trying to compete for the same seats that this foundation was created for. So what I would really like you to see you do is, instead of encouraging illegal immigration, to encourage legal immigration and to continue to allow this foundation to provide for the U.S. citizen that has the same desires and goals that they want to also fulfill their payment on their loans. And you're severely limiting their resources. Would you consider passing a bill that violates your oath of office and immigration law? You're promoting and rewarding illegal immigration from, as I said, 195 countries throughout the world. Often, people in government wonder, why do Americans do not trust the government? We do not trust the government because this bill is a perfect example of that. You're writing bills for illegal aliens, not the U.S. citizen. In fact, this bill promotes illegal alien privilege. Thank you.
Thank you. Please proceed. Name and position.
I'm Dr. Newman. I'm a research clinical psychologist, trained at the medical level in medical school, but chose to get a PhD. And I want to say, Chair Hernandez, you're doing a splendid job. I want to say that I published a number of articles, empirical research articles, in journals in the past, that I've taught at the university level. I'm concerned about supporting illegal immigration in this way. I know a number of physician colleagues from Iraq, Iran, Afghanistan, and Mexico. Some of my friends got their degree at the University of Guadalajara in Mexico. I do know that there are plenty of physicians around the world and nurses and other medical people who would love to come to the United States to practice. I also know that the altruistic intentions of beginning medical students is rarely extended through their internship and their residency and a return to their community, to their roots. Their hearts are there, but they don't return there. I know that, Chairman, from firsthand experience with this issue. I also know that the legislature in this state cannot dictate to the regents of the University of California what their policy is to be. I also know the taxpayers of the state of California, when they know what their legislature is doing, many times, and this is an illustration, do not approve. I know and I was very glad to hear the Loma Linda University a medical student testify here today. I know the professor who teaches there, who teaches medical students who lose their vision from year 1 to year 4 and encourages them to maintain their commitment to their community of origin, but they don't, for the most part. For the most part. You're looking at one who did, because that's where my heart has been. I am now retired. There, however, is no provision in this bill to mandate that. University of Guadalajara requires 2 years of service in the outback to fulfill their requirements. And that needs to be inserted in this bill if, in fact, it is to go through. However, I do encourage a no vote on this bill. Thank you.
Thank you. Is there anyone else? We can just please state your name and position. Thank you.
Mike McGetrick, this bill is going to tank the state of California. You guys have to start thinking about what you're spending, money that you don't have. And it might be nice to do, but you have to start thinking about the deficit. The state is, you know, what, $1 trillion in debt? And you guys are finding more creative ways to spend money? I think you guys are just a bunch of irresponsible, not very particularly bright people.
Sir, name and position only.
Wes Parker of the Stop the Corrupt United Nations, and I oppose this illegal, racist bill.
Stella Stevens with the Concerned Citizens of California. Strongly oppose 1139 because the thousands of dollars in student waiver loans for illegals will dry up the funds for citizens. To have illegals get the loans waived and forgiven and not citizens is totally wrong.
Deanne Deline, We the People Rising, fair tax. Taught for 47 years. My daughter went into education. She was promised the apple and to pay for her loans, and it didn't happen. Where did the money go? Where will the money go for these people? I oppose the bill.
Janet West,
Citizens for Constitutional Governance. I oppose this bill.
Robin Vidston with the Remembrance Project. I oppose this bill.
Robert Loughton, a National Coalition for Immigration Reform Action. I oppose this bill.
Thank you. Anyone else in opposition? Questions, comments from any of the members? Questions, comments from any of the members? Yes, Senator Pan.
Thank you. Senator Lara, I want to thank you for bringing this bill forward. Actually, my brief comment is actually to our two students who testified. As a physician, a fellow physician, I want to thank you for coming to testify, and just to say that we actually need you in the profession, and we need you in the state of California, and we need, and so I appreciate that you took the time to do that, and I know that many of the other physicians who came to testify in favor of the bill also proud to welcome you to our profession, to have you part of our profession. Thank you.
Thank you. Senator Wolk.
Yes, I want to thank Senator Lara for bringing forward this bill. We have a tradition that predates the groups that have come here today and support the bill, and that is to look at underserved areas and to see if we can put medical personnel in those areas. And prior to this, it's been, poorer areas, rural areas, which are extremely underserved. So we have a proud tradition of doing that, and we have clearly underserved areas where we want people to, we want professionals to move out of the cities and where they tend to stay and away from the medical schools and go into many of the states and the communities, and in particular in California. So I support that strongly. And has the bill been moved? Did you move the bill? All right.
Did you move the bill, or you want to speak?
I want to speak.
Senator Hall.
I also want to thank the senator for bringing this very important piece of legislation forward. I'd like to be added as a co-author on the legislation. And, when you do good, Senator Lara, you have to remember that evil is always present. So thank you for your work, and I look forward to supporting this measure as it moves forward. Thank you.
Thank you. Is there a motion? Senator Pan. Senator Lara, I've got a couple of comments, no questions. Again, thank you, obviously, for bringing the issue forward. We have a huge shortage of workforce, and that shortage is within predominantly communities of color in the areas where there's the most greatest need. And yes, we do have mechanisms for all students in the United States here who can get loan repayment for working in underserved areas. We can get loan repayment through working in federally qualified health centers. We have scholarship programs for all students, legal and undocumented. But even that, saying for the students that are here that are not undocumented, there's still a huge access problem. This is just part of the solution to be able to address that issue, and it's, to be able to allow these individuals to return back and serve those communities as well. So obviously I'll be supporting the bill, and I'd like to see if you'd like to close.
Thank you, Mr. Chair and members. Thank you for indulging me since 2001 when I began working on AB 540 to allow our undocumented students to have in-state tuition at our public universities and colleges. This has really been a labor of love for me, and now to be able to actually be the author of some of these measures means the world to me. And I want to congratulate the medical students that spoke today. I think Marcela's story really highlights the cultural richness that we have here in California, and in particular in the Inland Empire, where we have such a rich tradition of Chinese immigrants there. And you can actually ask Marcela that the best Chinese food actually comes from Mexicali. And I'm actually very proud of that fact. Members, U.S. citizens qualify for all these programs already. Let's not be fooled. We're not handing out any special privileges to anyone. These are programs that are already eligible to our U.S. student counterparts. And under the Constitution, the United States Constitution, we by law have to educate every child in this country. So what are we doing is not losing that investment that we've already made. We, by law, have to ensure that these children get an education. What is the message that we're sending when we've already asked them to be the best and brightest, when we've asked them to get the best grades, asked them to get into the best universities, and now going into a profession, such a noble profession as medicine, and then we drop them by not offering them these programs? This is a lost investment that we are doing. And so what we're doing today is rectifying that, ensuring that these children that have done everything we've asked them to do, now we say California continues to invest in you. And California has continued to invest in them since 2001. And the sky hasn't fallen. We are not in a $1 trillion deficit, as some folks asked. You're entitled to your own opinions, but not to your own facts. The fact is that California is stronger more than ever. We continue to be the 7th largest economy in the world. There's only 6 other economies that are larger than the state of California. And we cannot deny that the work of our undocumented communities that these students are doing are contributing to our economic greatness. And so, members, again, poll after poll after poll state that the California residents and California citizens support our dreamers. They want our dreamers to succeed. Let's not be fooled by fallacies and misnomers, but let's go with the facts. And the facts state very clear that California residents, California U.S. citizens support our dreamers. They want them to succeed and want them to continue to contribute to our economy at a greater scale. What better way than to allowing them to become medical doctors, to allow them to pursue their medical degrees so that they can go back to our communities and be those responsible doctors, responsible community leaders that care for our community. With that, I respectfully ask for your aye vote.
Okay, we're on item number 8, SB 1139. Laura, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Aye. Hall, aye. Mitchell. Monning. Aye. Monning, aye. Nielsen. Nielsen, no. Pan. Aye. Pan, aye. Roth. Aye. Roth, aye. Wolk. Aye. Wolk, aye.
Currently has 6-1. That's enough to get out. We're going to place the bill on call. We're going to now move on to
Thank you, Mr. Chair, members.
yes, yes, Senator Nielsen.
Mr. Chairman, I want to make an acknowledgement. There's obviously a lot of support for the bill. I didn't want to engage in the debate, but I want to acknowledge that there are a lot of Americans and a lot of Californians who feel that there's a reverse injustice that's evolving here, and they feel very passionately strong about it too. And they are seeking balance, and some of us are going to become a more vigorous voice, I think, for those Californians and those Americans as the debate continues. It need not become a polarizing debate, but it is a necessary debate. And I would argue both sides need to be sensitive. The proponents of more opportunities for the undocumented have to be sensitive to those concerns, and that is not the concern of the minority. I would argue that is a concern of the majority. And their side of it must be to accommodate the balance and to ensure there's not a discrimination against those legitimately here and who have raised generations of children. The greatness of this nation is that it has been a melting pot of assimilation, of becoming citizens, stable, and raising generations here.
Thank you very much, Senator. We can please refrain. We're going to move on to...
Mr. Chair, this is a moral issue. All men are created equal, and that's what America is all about. And that is a statement that it's just shocking to hear a Californian American say such words as my dear friend has uttered. And it's almost discriminatory in sound. And I'm just shameful to say that I heard you utter such words like this as being a senator of this House in America, where the foundation of California was built on the backs of immigrants, and you know that. Very shameful.
I do not accept your designation.
Okay, we're going to stop the dialogue. What I would ask that we stay on track with the policy and that everyone has a right to their opinion, but that we have their opinion be said in a respectful manner. We're going to now move on to, I guess we're going in order. Senator Pavley, item number 4, SB 999, health insurance, contraceptives, annual supply.